Hello. This is the Strict Doctor, and today we are going to look at one of the STDs that really is really infecting people so much, and is one of the dreaded. We're going to look at gonorrhea. Gonorrhea is one of the genital infections that usually affect our both the female and the male genitalia, and usually it's abbreviated by GC. Uh, and Gonorrhea is uh, it could cause sterility in women. It could cause blockage of the urethra in men, or can also cause ectopic pregnancy in women, and in children it can cause blindness, especially if the mother contracts GC or gonorrhea when she is pregnant. So those are some of the effects of gonorrhea, and the symptoms is that you'll have either whitish or grayish discharge coming from your genitalia, especially for men, and difficulty in passing urine, and while also passing urine, you'll feel some burning sensation. And for women, gonorrhea is usually not detected very fast, but for men, the incubation period takes between 3 to 4 days, and you'll actually know that you have gonorrhea. And to test for gonorrhea, usually in the medical labs, they take cotton swabs, take the secretions on the either vagina or penis, and they'll do syphilis test. So when the gonococci turns to be positive, that means that you are infected with gonorrhea, and if it turns to be negative, that means that you are not infected with gonorrhea. And our main topic of today is medical treatment of, of gonorrhea. And one of the first line drugs for gonorrhea is streptomycin, and we also have cephalosporins. However, those drugs are very expensive. Usually, they're just got in Western countries and European countries, and high-end hospitals, very few in Africa. But initially, gonorrhea used to be treated using penicillin and tetracycline, but in Africa, it has proved not to be working, and it was discarded, though in some places it's being used. But the main reason why it's not used in Africa is because we have penicillins producing gonorrhea. So that means that the gonorrhea that we have in Africa, some of the strains, they produce penicillin, the penicillin that is used to make penicillin. So you cannot actually use penicillin to treat a disease that is caused by penicillin produced to treat actually penicillin produced gonorrhea. So penicillin not very used, tetracycline not very used. But today, the first line of drugs that I usually used is norfloxacin, and it's being administered 800 grams, 800 mgs per. It's taken as one dose orally. We also have oxofloxacin. Oxofloxacin is taken 400 mgs as one dose, and we also have we also have ceftriaxone that is administered as IM, intramuscular, as an injection, 125 milligrams, and it is, yeah, those are first the common. You also have enaxin, that is also another drug that is used to treat gonorrhea. But for better management of gonorrhea, you could actually use a combination of norfloxacin, 800 mgs, that you take for 4 days, and doxycycline. No, norfloxacin that is taken as one dose. You take it all as one dose, 800 mgs, and then you follow it up with doxycycline that is taken, doxycycline 100 mgs, taken 5 days for 5 days. Yes, take 2 per day for 5 days. Then that is the first line of drugs, and you could also use ceftriaxone that is injected intramuscular, and the injection is given for 3 days, 2 times a day. Yes, and we also have gentamicin, that is 2 grams gentamicin, that is given intramuscular, given with also doxycycline for 5 days. And in children, usually when children are born, especially those that are born of women that have contracted gonorrhea, the first thing that should be done is to wash the child's eyes and the face using normal saline. So with the normal saline, you're going to be removing the mucus, because you usually have a mucous membrane that now has the gonococci in it. So when you wash it, it's like you're trying to clean it a bit so that you can now apply medication. Also, you could use warm water if you don't have normal saline. Yes, and to children, you can administer. It's not advisable to administer tetracycline on the eyes, because it could have an irritation, or could actually affect the eyes of the kid. So you could administer gentamicin as a alternative treatment for gonorrhea in kids. In kids, it's known as ophthalmia neonatrum. So I think that is. And another thing about gonorrhea, the preventive measures, is that as a medical officer, or a medical as a medic, you should also advise or counsel the patients, both the patient and her or his partner, to use either a condom while engaging in intercourse, and also when treating for STDs, all STDs, is wise to treat both the patient that has come to you for treatment and also his partner, or even her partners if she has multiple partners. But in an event that you treat only one, the patient who has come without their partner, she'll go back, she'll be infected, or if she has another partner who has another partner, the cycle will continue. So that is all for the management of gonorrhea. This is the Strict Doctor by your able Alan Patton. Thank you.